So Gregory, I think I might give you a run for your money in terms of where I'm placed. But anyway, I mean, I think what I'd like to do today is to take a step with me sideways and to start thinking about where education and clinical training fits in this conversation that we've been having today. So really, the question I pose to you today is, what's the role of clinical education in transforming health? How can education inform health system reform? And how can clinical education and training actually inform the change that we desire in the way we deliver healthcare and in the culture of healthcare delivery? So I'm Koshila Kumar. I'm a lecturer at the Flinders University Rural Clinical School. And so I hope I can take you on a journey with me today for the next 10 minutes or so, just to sort of talk to you about something very dear to our hearts. So we actually thought, well, you know, let's just pitch this as two interlinked projects. So the first project that we're really looking at is what sort of model of student learning within the clinical workplace can actually help to transform quality and safety in the health service. How can we get our next generation of students who are training in the clinical workplaces actually involved in quality and safety initiatives in the clinical workplace in a meaningful way? The second project is very much about the clinical teacher. So the conversation we had just before I came on about communication skills training, education, that all was a really nice segue into this presentation. It's about how can clinical educators actually be part of this and lead educational change, but also bearing in mind what do they do in terms of leading change so they can actually transform quality and safety in the health service. So how can we empower them as teachers to do that? So those are the two projects that we sort of are broadly proposing. And so why would we, why are these important? Why would we even consider these projects? They seem quite left field. I've been listening here, I must admit, with some feelings about not being sure where this sits. But so why would we actually care about this? So these projects are really about saying, well, how do we provide our next generation of healthcare professionals with meaningful learning experiences in the clinical workplace? We've talked about how important that was. How do we get students engaged in the health service? But how do we get them engaged in the health service in quality and safety initiatives that actually help to transform health, which is what we're here to talk about today. How do we harness the enthusiasm of students who want to make a difference to quality and safety in the health system? But how do we also enhance the capacity of the clinical leaders to actually direct and take charge of changing the system? So those are two questions, but I think the really important questions are the ones below. So it's really about saying, how can clinical education and training add value to the South Australian health system by helping to transform quality and safety? Where does education fit into this conversation? Where does the education of our next generation of healthcare practitioners, where does the continuing education of our current workforce fit into this conversation? And how can we build or harness symbiotic and sustainable partnerships between health and education? So when I talk about symbiosis, what I mean, again, is not just about cooperation, not just about collaboration, but about having enduring, interdependent and mutually beneficial relationships between health services, between universities, between education, between health. So it's really a win-win situation. So these are kind of the questions and things that I really want you to, I suppose, engage in or think about and say, how are we going to actually do this? Because the health service is a place where almost 50% of training and education happens of the next generation of the workforce. Many of you sitting here are the clinical teachers that provide that training. How do we engage you in that with that hat on? So here I am asking you questions. Might be a bit late in the day, but anyway. So who's the team? Just a very quick. So we're basically a interdisciplinary research team, but based within the university. We come from health, so medicine, nursing, and allied health are represented, and myself from education. But what we're looking for clinical partners. We're looking for clinicians who are passionate about education, who are sitting here asking the same questions. How does education inform health system reform? How does education and training fit into this conversation about changing the culture of healthcare delivery? So we want people from the local health networks to come join us, be our clinical partners, and give us access to your world so that we can start to work in symbiotic ways to kind of address the questions I posed before. So a bit more about the projects. So project one, as I mentioned, was very much about how do we get students integrated into the workplace, working in meaningful ways to transform quality and safety in the health service. So the ideas about project one, it's about using a case study approach. That's what our methodology will be. And what we want to do is we want to talk to our clinical partners and identify areas of best practice which are aligned with the quality and safety priorities for South SA Health, where students are actually engaged in quality and safety initiatives. So we covered a range of things today, from clinical handover, medication safety, patient identification, transitions in care, which were identified as kind of key areas of quality and safety. And to the list I could probably add things around long stays. I think a couple of people mentioned unplanned readmissions, another area of concern perhaps, acute end-of-life care. How can we get our students actually contributing in meaningful ways to these quality and safety initiatives? And who do we need to engage in order to do that? So that would be step one. So we'd have consultations with our clinical partners, with people from the quality and safety unit to say what are the priorities for you and how can students actually be part of the solution. Then we'd actually start to gather some qualitative data about those best practice case studies. We're saying, well, how are students involved? What is their role? What are the role of the clinical teachers in that, and what real world problems are faced in actually getting students involved in these quality and safety initiatives? So it's about getting a real sense, using that case study approach of providing a snapshot, I suppose, of where things are working well and how that might actually inform a model of how we can start to actually get students working in projects that help to transform quality and safety in the health service. So when I say the health service, again, I'm referring to the tertiary hospital setting, because that's kind of the focus at the moment. But as I mentioned, clinical education happens in lots of places. But for the time being, the focus will be actually on the tertiary hospital. So that's project one. Project two, this is very much about the clinical teachers themselves, the clinicians who teach, which is really all clinicians. So how can clinical teachers lead educational change within the health system to transform quality and safety? So that's our next project, and that's the next question that we're posing. So here we actually want to use a bit of an action research approach, which means we're going to do more than just plan and observe and collect some data and make sense of it. We actually want to put some steps to developing and implementing a model that may make a difference. But again, to start off with, we would interview our clinical teachers, others, including people from the quality and safety units and other interested stakeholders, maybe people who are representing consumers as well, to say, how do clinical teachers set up teachable moments in relation to safety and quality? How do they get their students involved in these initiatives? How does the health system actually enable this, or how does it impede this? and what does that look like? So that's the plan, to gather some observational qualitative data to get a sense of the scene. And then to actually undertake some discussions now with those same people, but very much around brainstorming the learning opportunities, maybe the missed learning opportunities, and the strategies that we can actually use to promote student involvement in more meaningful ways in these quality and safety initiatives. So that's about saying what are some of the solutions, what might they look like, and again we would rely on our clinical partners to put some parameters around what that would look like. So here comes the action research part of it. This is about, now we've done the planning, we've done some data gathering, we actually want to try and implement some of the strategies and solutions that have been suggested, that have been informed by the literature. So implement some solutions and strategies, and then most importantly to evaluate and critically reflect on what works, how does it work, and why does it work. So not just looking at outcomes, but looking at processes and the context in which certain initiatives might have been more successful than others, why, for whom, in what ways. And the final part would be, again, to develop a model to actually enhance clinical teachers' capacity to lead this educational change within health systems. So it's very much saying education, health are symbiotically linked, they're interdependent, and they need to work in much more connected ways. All right, so those are the two projects. I think I'm sort of going through my slides quite fast, but anyway. All right, so yes, this is the last slide. So, I mean, I could keep talking, but I was only allowed 5 slides. So, looking ahead, what do we envision might happen in the next 6 months or so? What am I trying to do here? I guess I'm trying to gather interest. I'm trying to say to people who are interested in clinical education, who are sitting there and who are passionate about how education can actually inform health system reform, how it can actually inform the change in healthcare delivery. Come and talk to me, and let's work together to try and address some of these questions. So we're looking for clinical partners from different local health networks, any discipline. Doesn't matter, to have these conversations and to start looking at this in a meaningful way. So being symbiotic, where's the win-win? We're getting something. What do our clinical partners get? So what we really want are for these people we're offering them an opportunity to undertake, we run a Master of Clinical Education, which is very much a postgraduate program based at Flinders University that essentially is for clinicians to really reflect on their teaching practices, to think about how they teach, why and how, and consider that in a very sort of rigorous way rather than simply teaching because that's how you've been taught or that's what you've observed others doing. So we want people to come on board, but to engage with us in these projects, but also to engage in our program, and we offer that opportunity for them to undertake the program and these projects as part of their research capstone. So that's our little opportunity that we've created for them. So it's about saying we're going to work together to try and address some of these questions, but here is what we can also try and offer you if you were interested. And finally, what we would ideally like to do is that I talked about how both projects would inform the development of a model. The first one was about a model related to how we actually integrate students into the health system in meaningful ways and get them involved in quality and safety initiatives and get them to make a difference to health. The second one was about developing a model for enhancing the clinical teacher's capacity to lead that educational change and to be kind of an educational champion within the health system. So ideally what we'd like to do, and I think this is very long term, is to actually partner with health, with other people, to really try and implement and evaluate these models of work integrated learning placements within the health service. But those that actually are linked to transforming quality and safety. So again, we'd have to make use of routinely collected data, clinical data, to actually say, how are these changing quality and safety. But our idea is to say, what sort of work-based model of education or training does the health system need, and how can we work together to actually address that? So that's me, ahead of time. Thank you.
So we have time for one or two questions before we hand over to Dorothy. So we have someone over there.
Thank you for your presentation. I just need to put my glasses back on.
That's all right. I never take mine off.
We heard of Janet's mapping of patient journeys and of the use of this to educate. Also, Cancer Voices leads a patient as teachers program with Adelaide Uni third-year med students, and recently at Flinders University with the first-year nursing students, for example. In the symbiotic and sustainable partnership that you spoke of, I'm wondering if you've given thought to utilising patients as teachers as a strategy in order to learn from the patient experience in a collaborative two-way exchange with the aim of improving quality, safety and communication.
Thank you. Very important question, and it was something I was reflecting on in relation to this presentation. When I was sort of listening to everyone else, I thought, wow, I haven't actually talked about that much. I might have in the abstract. But I think that concept of learning with, from and about the patient is very much part and parcel of clinical education and training. That's what we'd like. The patient-centeredness is very much about how we'd like the clinical education and training to happen, in the sense of this project and how patients would fit in as partners. I guess I would see them as part of, in Project 1, for example, informing, or we could consult with patients in terms of where they saw their role as in engaging students in these kind of clinical settings, so patients as teachers. Again, I think there's some recognition to be given that it is about changing a cultural mind shift about the role of patients as teachers. Sometimes easy to do in certain settings and not. So I think part of this project would be saying, where do patients fit in and how do they fit in, and how can we engage them better to answer some of those questions. So even with our second project, which was around the clinical educators and enhancing their capacity to initiate change or lead change in the health system, where do the patients actually fit in? So thank you for bringing that up, and I think I have to admit that's probably one of the things I'll have to go back and do a bit of work on. But I recognise that it's probably an unaddressed part of this vision.
Thank you, and thank you very much.
Thank
we
you.
have to leave it at that. And
All right.